Mrs. Smith. My name is Maggie. I'm your nurse today. I am going to just put in a catheter so we can obtain a urine specimen from you. Can you start out by giving me your name and date of birth, and I'm going to check your armband? Great. Do you have any pain today? A little? How would you rate that pain in your head on a scale of 1 to 10? Okay, 2. It's not bad. All right. So first, I am going to roll this up to expose the patient. And I'm going to open my sterile kit. Here are the sterile gloves. And I am going to start by putting on my sterile gloves. Putting it up. The first glove, you might want to come. First glove, I am going to slide my hand under the cuff. Adjust that when I get the other glove on. And slide this finger under here. Now I'm going to adjust this because this is now sterile. All right. And there are 2 drapes. And the first drape has a fenestration, which is going to be placed over the vagina. But first I'm going to place this drape underneath the patient's bottom with the shiny side that's going to be down. And I would ask the patient to lift their hips if they are able so that my sterile gloves would not touch the patient, but for purposes of this video, slide this underneath here, and then I would use this second drape to put a hole over the vagina, the little triangle. And once again, we're going to want the shiny side down. Right. Probably could have done that better, so it wouldn't have touched the patient so much, but okay. I can touch it with my sterile gloves because this is all a sterile area now. I'm going to move the catheter and the lubricant over to this sterile field. Important to kind of coil it up so it doesn't go flying all over the place when I open it. This is going to be the end that I will stick in the patient's urethra. So I am going to place it in lubricant. And you're supposed to put it in the lubricant as far as it will go. Now, I'm going to take these betadine swipes, and they're pre-treated little swiped applicators, and what you would do is I'm going to use my non-dominant hand, which is now going to be dirty because it's going to touch the patient, with this hand remaining sterile. And open this up, and you would use, holding the labia open with your non-dominant hand, you're going to use one swipe for the outer lips of the vagina, then you're going to discard that swab, and you would discard always with your non-dominant hand so it can move around and it's not as sterile. You would hold it open again, swipe and cleanse the inner lips, then you would throw it out, and then wipe once from top to bottom, down the middle, and then you would discard that. Right. Should have reached over with my non-dominant hand, but it's okay. Alright, so we aren't going to be using this in the video, but this is where I would be collecting a specimen. Alright, so I am going to keep my non-dominant hand still opening up and take the catheter. Alright, I'm going to go ahead and put in the catheter. Just want you to count 3, take a deep breath. You're going to feel a little bit of pressure. Okay. And the catheter would drain into the cup. Okay, urine is now draining. And I made sure to put the catheter into the urethra, which is the hole above the vagina. Okay, after the urine has stopped draining now, all right, I'm going to go ahead and take out the catheter. You are going to feel a little bit of pressure. All right, and then also excess urine when you're done with the 20 to 30 milliliters of the specimen would be placed in here. I forgot to mention when I would be inserting the cath. I'll pretend like I haven't done it. You hold it 3 to 4 inches away, and then once you stick it in, so I'll re-enter, you would advance the catheter 2 to 3 inches or until you start to see the urine. All right, so I would then remove the catheter, and now I just need to get rid of supplies. I would now wash the perineal area with soap and water, or I could also use the drape to help wipe up the patient. Now, before I remove the sterile gloves, I'm going to discard all my supplies. All right, cover up the patient. Lower this back down a little bit. All right, Mrs. Smith, do you need anything else while I'm in here? No? Okay. Your call light is going to be right here. Just press it if you need anything, and me or one of the other nurses will be able to help you. Then foam out, hand hygiene.